Hi, my name's Amy Rumora. I'm a postdoctoral fellow in Dr. Eva Feldman's lab in the neurology department at the University of Michigan, and I study diabetic neuropathy. Diabetic neuropathy is the most common complication of diabetes, affecting up to 60% of patients with type 2 diabetes. Diabetic neuropathy can result in a severe loss of sensation in the limbs and can eventually progress to a level where it can cause amputation in patients with diabetic neuropathy. Unfortunately, there are no disease-modifying therapies to treat diabetic neuropathy, but recent studies in the Feldman lab have shown that increased levels of fatty acids in patients with diabetes can lead to the progression of diabetic neuropathy. I'm interested in understanding how different types of fatty acids impact the sensory neurons that are involved in the development of diabetic neuropathy. Sensory neurons extend axons up to 1 meter in length from the spinal cord to the peripheral nerves and require energy throughout the entire length of the axon. The organelle that is responsible for producing this energy is the mitochondria, and it's transported up and down the axon by molecular motors. Interestingly, what we found is that saturated fatty acids found in hamburgers and red meat can impair mitochondrial function and reduce mitochondrial transport throughout the axon. Interestingly, oleate, a monounsaturated fatty acid that's found in olive oil, is actually beneficial for mitochondrial function and can rescue the impairment of mitochondrial function that's caused by saturated fatty acids. What's interesting is that now we're translating this work into mouse models of diabetic neuropathy, and what we've found is that oleate can reverse the progression of diabetic neuropathy and restore nerve function. We're now going to use these mouse models to identify molecular mechanisms that are altered in diabetic neuropathy to hopefully develop new treatments for this complication.